Welcome to today's COVID-19 update. We're speaking with the Honorable Minister of Health, Dr. Frank Anthony. Minister Anthony, thank you again for joining us.
Well, thank you very much for having me on your program.
All right, one of our first questions to you today is the IDB. Recently, we got $22 million US dollars, and then the World Bank approved a 7.5 million US. Could you basically tell us how much this will go into assisting Ghana with its COVID-19 fight?
Well, immediately upon assuming office, one of the mandates of the president was to ask us to look at these two institutions and to see whether or not we'll be able to mobilize resources from these two institutions. So we did set up a technical team, and we engaged both institutions, and from those engagements we now have two loans that we have been able to negotiate and soon to be signed. So we are very happy that we have done this in perhaps record time, because these institutions take a long time sometimes to go through all the different types of studies and paperwork that is necessary. But I think our local team, which comprise of persons from the Ministry of Health, Ministry of Finance, worked very diligently to ensure that we meet regularly with the IDB team and put that particular loan together. And we also had our technical team plus Ministry of Finance working with the World Bank to put the second loan in place. So we're very happy. These loans are going to help us to improve our response. It's going to help us, for example, with the World Bank, $7.5 million. $7 million is focused on the response itself, with 500,000 being available for monitoring and evaluation and management of that particular project. The $7 million, we are looking at developing and strengthening our laboratory capacity, not just centrally, but in the regions as well. So that's one area that we are looking at. We want to improve contact tracing so that if there's anybody who is positive, that we can trace all the people they have been in contact with. We are looking at improving hospital capacity, so improving the types of equipment that we have, ventilators, beds, monitors, other types of diagnostic equipment that is necessary to be able to do proper diagnosis. So there are a number of things that we are going to use these resources for, and I think it's going to enhance our ability to deliver higher quality of COVID-19 care.
Okay. In terms of both facilities, what are the specifics of the loan? Are we going to get all the money at once, or are they coming in parts?
No, there is a structure that we have to work with, and we have a project management unit that is going to be working with the IDB team and the World Bank team to unlock the resources. These are standardized procedures that you have to go through. So we have the team already that is working on that.
All right. If I can ask you, still with the loan, what is the repayment? Because it is a loan. What is the repayment timeline? And is there an...
We have suitable timelines. So these are loans that both IDB and World Bank has put together because of the emergency with COVID, and they have set aside resources to help countries because they recognize that countries might be challenged during this period to find the resources necessary to respond to the COVID-19 pandemic. So this is a special facility that has been available.
Okay, thank you, sir. The COVID-19 vaccines, What can we get an update as to where we are right now? We know that there's still testing and so on going on. So anything new that is coming out of that area?
Well, on a daily basis, I would say things are happening with vaccines. We have, for example, the three that are now known that are out there. That's the AstraZeneca one, Pfizer, and Moderna. We have also seen that the Russians have spoken about Sputnik 5, and that seemed to have a high efficacy as well, at about 95%. So once the data become available, we'll learn more about how that works and if the data holds up. So you also have a number of joint production between China and other countries, a number of other vaccine candidates, and I'm sure within the next week or two, we'll be seeing results from those as well. So there is a number of vaccines now that are going to become available. And as I've said before, we're operating through the COVAX mechanism, so they would help us to pre-qualify the vaccines that would be part of that portfolio, and then we'll get from that. So we continue to work with them. In terms of readiness, locally, we have been working to ensure that our cold chain can accommodate any one of the available vaccines. So whether it's -80, -20, or the normal 2 to 8 degrees Celsius, we have expanded our cold chain to ensure that we can deal with any one of those vaccines.
All right. Can I now ask you for an update in Region 6 and Siparuta?
Yeah, Region 6, we have seen a number of cases. We have seen a slight increase in cases in New Amsterdam. And of course, we have cases in Oriala and we have cases in Siparuta. The amount of cases in Siparuta, because of the testing that we have done, has gone up slightly. But again, we have been actively monitoring the situation, and we expect within a 2-week period that you'll see those numbers going down.
Any other region that we are monitoring?
Well, we are monitoring in all the regions.
Yes, I actually meant specifically Region 1. I know you've had good results coming out of there. Anything new?
Region 1, so far, that has been good. The area that was of some concern to us was Warapoka, where we've seen a decline in cases. Region 2, again, we have a team that is out there monitoring. We had a slight increase in cases in the Hampton Court area, but we've already started seeing a decline as we start discharging people. In Bartica, we have seen an increase in cases. We have about 65 cases there right now, and we continue to monitor that. And the team that is there have assured us that they have isolated the people who have tested positive. They're looking at the contacts, and we'll continue to observe. And if there's need for any intervention, hospitalization, or so forth, our facilities are ready, and we will be able to take care of those patients.
Thank you. If I can ask you, we've done this before, but for the sake of a reminder, why is it necessary for us to take 20 seconds to wash our hands? It's a funny question, but Minister, we know that we take it for granted. We take most things for granted.
So the logic behind washing your hands is that very often and unconsciously you would touch your face with your hands. So if somebody monitor you for maybe a minute, you unconsciously would touch your face several times during that minute. And the thing with COVID is that if you are moving around in a room or any environment, your hands would come in contact with various surfaces. So let's say you're going into a room, you have to open the door before you get into the room, so you're touching the doorknob. You don't know who might have been someone before you who opened that door, whether they were positive, whether they had viral particles on their hands. And so when they touch these surfaces and you touch them after them, the possibility is that you can contaminate your fingers. And then when you unconsciously put it to your face, then you would also be infected because you're going to breathe in these viral particles. So the logic of washing your hands often really is to prevent things like that from happening. And that's why we're asking people to sanitize. Now, the reason for 20 seconds is that you want to wash your hands thoroughly. Some people just throw some water on their hands and that's it. That's not proper washing. If you really want to get rid of viral and bacterial particles on your hands, you have to make sure that you do a thorough washing and you use soap and water to do that. So 20 seconds or singing happy birthday twice allows you to spend enough time to thoroughly wash your hands. And there are various techniques that one can use, but the whole idea is to make sure that you cover all the surfaces in between your fingers and things like that so that you have a thoroughly washed hands.
All right, Vincent, thank you so much. We know today, like most days, are very busy for you. So thank you for squeezing us in this morning. Thanks again. Have a good day.
Well, thank you.
Well, that's it for today's COVID-19 update. Of course, we've just spoken with the Honorable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and of course, our social media platforms.